Hello, everyone. My name's Doug Rammel. What we're going to talk today is part of the Curb the Panic series. What can retail, CPG, and other companies and executives do to help?
Three areas that we're really intrigued by that also companies are stepping up is how do you now deal with your employees? Recognizing they're in very, very different situations. CEO of Marriott, which is struggling. They've had significant layoffs, but he and senior executives have gone to no pay. They are providing furlough and support for those. I'm on the board of a company. We just increased the wages of, which is making food products. We've increased the wages of our frontline workers, our factory workers by 50%, so they can have a real incentive to go to work, to continue to be part of the solution here that we're going forward. The other area is communities and how companies can really step up. Sometimes it may be with specific resources, skills, capabilities, and people. Other times it may be money. And I will say in this occasion, the banks, which I think we as a society helped out last time, are stepping up this time.
I think for the big corporations, I do think there's unique partnerships they can do with hospitals. And so I guess I would say be patient in trying to get through to us, because we've made some really unique connections, people who are willing to turn their operations into scrubs. A neighborhood of ours where they've given us their parking spaces. They're obviously not being used. It was a huge morale boost to our employees that we can allow everyone to park because those spaces were donated to us from neighbor businesses. So I'd say be patient, think of areas of overlap, again, foods, products, or services, and try to make those connections with your hospitals.
Public health is one of those areas that when there's nothing happening, we think it's a terrible waste of an investment. When a crisis happens, why aren't there twice as many of these people involved? Ironically, prior to the start of this crisis, the School of Public Health at L.S.U. and Tulane University across the street are working on a special issue of what lessons we've learned from Hurricane Katrina for the American Journal of Public Health and a September symposium about this. So we have 5 websites across the state, including one by the Department of Health, that allows people to sign in, indicate what their skills are, and allow people from the Office of Public Health, the Department of Health, to tap in to pull people into it.
Yeah, I think this was an effort that really came off a standing start, as Dean said. You know, we were not always as prepared as I think we would have loved to have been, but we are where we are, and we're seeing companies step up in a lot of ways. But all companies had an impact on this. The differences are really immense, and we're fielding daily dozens, scores of questions coming in from companies asking what others are doing, where they can be helpful, where they can be supportive. And then what we're working is convening companies around topics by industry, by issue, by geography, to have discussions and conversations about what are they doing so we can really share best practices. On testing, the test from Abbott looks to be a successful one, and to the degree that can really work, can be really helpful. People like Quest Diagnostics and BD are working on getting those test kits out and completing those tests in a faster way. PP&E is a big effort for all, and it's just been encouraging to see a number of companies like Hanes Brands or Estee Lauder to really convert their lines to be able to make the gear and kit that's really needed today.
What we discovered early on in this incident is we were actually overwhelmed with offers to help, and that's what we called it broadly, offers to help, because they were either people trying to connect us with more established distributors of how we might get PPE, or innovators who are looking to design or retool what they do to help healthcare workers, or employee appreciation, whether it was food or donations to encourage and help our staff. So we instantly realized we need to set up an organized portal for this because we were being overwhelmed. So we set up an electronic web to help us just sort through how to find the biggest and best opportunities that we can leverage of our scale.
What we need from the business community is find ways for people to stay in their lane, like do what they do, but do it efficiently and remotely. We have the hotels in here have stepped up. We have a large homeless population in New Orleans, many of whom are now at the Hilton Garden Inn. It would otherwise be empty, and now they're off the street. They're not spreading. It may be of help to their life. We have some other hotels that are working as short-term, long-term care facilities. When someone is discharged from a long-term care facility to a hospital because of an issue, they can't go back to the long-term care facility. Those are a real hotspot. So now they're at some of our nicer hotels in town. We have the food community has stepped up to help first responders and others in a time of crisis. And a lot of businesses have chipped in to help that. Logistics of getting meals to families who shouldn't be leaving, to first responders who can't leave.
I just want to thank everybody for participating. I realize that everyone's busy right now, and particularly for the two of you that are on the front lines, really appreciate the work that you're doing. Know that our thoughts are with you. We're going to get through this together.
Thanks, Doug.
Thank you, Doug.
Thanks, guys.
Thank you so much.